Hi, I'm Dr. David Wohl. I'm an HIV specialist here at the University of North Carolina in Chapel Hill, North Carolina. And I'm going to talk to you today about what to expect from HIV treatment. So thank you for being here. Thank you for listening to this because it's a really important first step to taking care of yourself. So if you're watching this, it's because you or maybe someone you care about has tested positive for HIV. And it's really important to make a decision that's good for your health and the health of those who you could transmit the virus to. So I'm really happy that you're educating yourself about treatment, about what to expect, what to look out for, again, because knowledge is really important and knowledge is power. So as you know, HIV is a virus, and it's a special type of virus that can harm the immune system. And when the immune system gets really, really, really weak, people can get sick, and we call that AIDS. So not everyone who has HIV has AIDS. Only when it progresses to a point where the immune system is so damaged that people get sick do we call that AIDS, which could be life-threatening. So we want to prevent that from happening. So we don't have a cure for HIV, but we do have treatments, and the treatments can control the virus. So the treatments can keep you healthy and have people live many, many years, if not decades, and also make it so that a person who's taking effective treatment doesn't transmit their virus to other people. So you don't delay. That's the key thing we tell people. There's no waiting to start HIV therapy. Once we know that the virus is there, we have to act, because all that time that the virus is replicating, it's killing some of those cells that help protect your body from infection. So we need to have treatment start as soon as possible after a person knows that they're HIV infected. The other key thing is that for the medicine to work, people have to take it just as directed. So if it's one pill once a day, you gotta take it every day without fail. It's really, really key. That's the way that the medicine works. That's the way that keeps you safe. So the really important thing to know about how HIV therapy works is that it's sort of like birth control for the virus. It doesn't kill the virus. It doesn't kill it on contact like bleach or something like that. What it is it prevents the virus from making copies of itself. So if it can't make baby virus, the amount of virus in your body gets limited. And remember, your immune system is fighting the virus, and we give the immune system the upper hand by not letting the virus make reinforcements. So it's really key. When you stop taking the medicine, the virus starts replicating again. When you start using the medicine, it's supposed to bottle up the virus and not let it cause trouble to your immune system. So it only takes time, it only takes being on therapy for a long period of time to really get the full benefit, and taking it every day as directed. So we have to take it forever. You said time. What does that mean? Right now, without a cure, we think that everyone starting on HIV therapy will take it indefinitely until we do get a cure. And I'm optimistic. I'm hopeful we'll see that day. But right now, we have really good therapies. And the good thing about our therapies are people tolerate them. So if you're on a pill a day, that might be something you just have to take, just like you would take a vitamin, or people with blood pressure problems take a blood pressure pill. It's what we need to do. And when the medicine's working, what does that mean? Well, that means that the amount of virus in somebody's blood drops down so low that our tests can't detect it, can't count it. So we know someone starts out with a bunch of virus, we can count that virus, and then it drops down. So it's sort of like needles in a haystack. If I put 10,000 needles in a haystack, I'm going to find some needles if I look for that in the haystack. But if I drop it down to maybe 5 needles in a haystack, I could look all day, I won't find those needles. Same thing for our tests. When it gets so low, we can't find the virus. And that's what we want. And we know that that's the optimal number, that's the goal. That's the gold medal, getting the virus undetectable. The other thing it means is that you don't have as much virus around in your genital secretions, not only your blood, but that means that you can't transmit the virus to someone else because the amount of virus is just too low to infect somebody else. So that's another good part of treatment. So sticking to it is really important. Sticking to your treatment plan, taking medicine every day. I understand it's not easy. Integrating this into your lifestyle. But you know what? We brush our teeth every day. We put on our shoes every day. We eat every day. We can take medicine every day. Make it a habit. Prime it with something that you're doing every day, like brushing your teeth. Okay, your immune system stays strong as long as you take the medicine, and if you have a strong immune system, you stay healthy. So sticking to the plan helps prevent resistance, because we didn't talk about that, but it's really important. If people don't take the medicine right, some of the medicines will stop working. So that's another key reason to take the medicine every day, in addition to protecting your health and protecting those around you. If you do skip your medicine, again, talk to your provider, understand what the problems are. Is it because it makes you nauseous? Well, maybe an alternative medicine will be for you. But you need to be on medicine that fits your lifestyle, that fits you, that works together. And if you miss a dose, that's not the end of the world. Just catch up, okay? If it's later in the day, take the pill that day. If you missed one day, just start back the next day. If you miss a lot of doses, again, that's something your provider should work on with you. So, people have different things that we have to think about. There's a lot that we're dealing with when we're dealing with a new diagnosis of HIV. We have to think about what are the most important things. And the other thing that people bring about all the time is concerns of safety. The great news is most of our medicines really, really work well and are safe, and they do not harm people. Certainly if you experience side effects, you have to talk to your provider. Nausea, vomiting, diarrhea, a rash, trouble sleeping, headache. Those are things you have to talk to a provider about. Again, there may be an alternative. So will this interfere with other things that we have to work on, like, hormone therapy or other medicines that you may be taking? If you are transgender and taking hormone therapy, good news is HIV therapy doesn't change your transition plan. The drugs that we most commonly use for HIV do not interact with hormone therapy. So talk to your provider if you have any concerns about that. They can provide you details, but this is not a big issue. This is an example of how it's important to communicate with your provider. Really having a good open conversation about your concerns, about things that you're feeling, whether it be through the visits, or maybe your provider likes text, or maybe through the electronic medical record, there's messaging. Whatever works for you, you need to have a good connection with your provider. And that's how you stay safe. That's how you work together as a partnership so that you can live a long time, healthy, and on medicine. This is not the end of the information that you need. There's lots of resources. At this website, you could find more information that can help you stay healthy and safe. Thank you again, and take care.